This podcast is sponsored by Boveda humidity packs. Boveda packs are meant to be stored with your cannabis flower. This helps control the relative humidity inside your jar, which is going to control the cannabinoid and terpene profile of your flower over time, so you'll never have to experience dry, crusty nugs. You may have seen Boveda packs in the weed bags you buy from the dispensary with your flower, but you can also purchase these for your home use. I highly encourage that you do, especially if you buy your flower in bulk. The packs come in a variety of sizes depending on how much bud you have at home. They are incredibly useful and affordable, and I noticed a huge difference when I started using these, and now I could never go back. I also want to note that every single Boveda employee that I have spoken with has been incredibly happy working at this company, and I have so much respect for them for being an ethical employer and helping fund education like this podcast. If you want to purchase some Boveda packs, the links will be available in the show notes of this episode. So I am so excited to have today's guest on, Dr. Mary Clifton, who is an MD. I will let Mary give a little more background on what her specialty is, but I actually found Mary through, you guessed it, TikTok. So Mary actually makes content on TikTok that's super accessible to a variety of different medical patients about many different things related to health and well-being. And I really appreciate you taking the effort to do that. And I've definitely learned a lot. So if you could just give a little more background on what your specialty in medicine is and kind of what your goal is with social media and all the work you're doing there.
Oh, sure. We have such a nice overlap, don't we, on TikTok?
Yeah.
Because you're focused on the science and on helping people to understand how the molecules work, and then my entire focus for 25 years has been clinical practice. So I graduated from medical school and ran a private solo practice for 14 years, focusing on osteoporosis and geriatrics. So I had a great time with osteoporosis. Really love that disease. And then eventually it just became too difficult to ignore what was happening in alternative therapies, particularly in cannabis. I had a lot of patients who were getting great results, and I kept thinking that it was a dangerous drug. I mean, back in high school, I smoked my body weight in cannabis. So I don't know why I thought it was so dangerous, but I did have a lot of paranoia way back then, but I probably did anyway,
We were
being
told
growing
it
up
was
Catholic.
dangerous. I mean, we were told it was going to make us lazy and stupid and we'd never be a functioning member of society. And, that is what we were told in high school. And
Mhm.
despite using these substances, like we really, that's the only information we had. And thank God we have all
Yeah.
this information now about the medicinal benefits and how to use it in a safe way and different consumption
Oh,
methods. But
yeah,
yeah,
my mom found a bag of weed at my house, and when I was like 18, 19 years old in the first part of college, and she just started to cry. She was like,
oh,
you're gonna ruin everything, and you're so smart. How could you put your intelligence at risk? I just can't believe you're doing this." And now, we have clear studies that the only impact on your intelligence, on your IQ. There's huge impacts on your EQ, right? On your emotional intelligence, but on your IQ, there's, no impact. And the short term memory impact that we used to say stretched on for years, later studies found 3 months. The most recent studies are saying it's almost all reversed in 3 days if you do have a
whoa.
short term memory impact.
Okay. I didn't even know
So
that.
it turns out that all of that was just prohibitionist craziness.
And actually, we did have a question from somebody on my Patreon who I posted that you were going to be on the podcast. And I said, hey, anybody got any questions? And we did have a question about
Mhm.
learning and memory, which, it's amazing. We just touched on that organically. But also, I think something that's not really discussed a lot, and this is kind of in relation to emotional intelligence too, is that sometimes using cannabis, it can affect your short-term memory, but it also can make you want to learn more. Like it can make you inspired and creative to learn more. And I think we don't really discuss that enough because I've used
Yeah.
it to study throughout undergraduate and graduate studies, and I genuinely don't think I would have been able to like grasp that knowledge and be interested in those subjects if I was not using cannabis.
Oh, I mean, and especially if you have ADHD or difficulty concentrating, or if you're just a human being. I mean, when I was in medical school, the hours at school were, 8 to 5 every day. I would come home and make my daughter dinner, put her to bed. I was a single mom at the time, and then I hit the books again and would study from 9 until 2, and then get up again at 7 or 6:30 to get everybody to school and get me back to medical school. I mean, that was superhuman, insane levels of concentration required, and I honestly don't know how I did it without medicating, to be honest.
Did you medicate like throughout the day and night or the night, like if you were
Oh no,
studying
I
late?
I quit using, because I also had concerns that it would impact my intelligence. So,
Mm.
I mean, when I went to community college to start for the first 2 years. And then after that, I think was when I put myself on a self-imposed prohibition and just focused on being sober and being a good mom and going to
No,
medical school, which was,
nothing
which
wrong
was
with
full
that.
time. That's about all
Yeah.
you can do.
Yeah,
And you
for
can't even
sure.
really do all of that well all the time.
Wow, just hearing what you were doing is like incredible. Just work, 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 sleep a little bit, and then just and being a mom is a
Yeah.
full-time job too, and going to medical school. I cannot
Oh,
imagine.
when we talk about PTSD and how, we bring these new medications forward for PTSD for veterans, and it's important because veterans, they see dead people, they see all kinds of horrible things. I have also seen all of that horrible stuff. I mean, you don't have to go to war to have really significant PTSD, and I think all of us in medicine, it's we talk about that sometimes about how hard it is to believe that more of us don't have an assault charge or a DUI or some sort of erratic behavior that gets noticed by law enforcement because there's just so much pressure and stress for so many years.
I don't think we talk about it enough. I mean, most of my best friends work in healthcare. So whether they're EMTs, paramedics, nurses, physician assistants, whatever it is, they're working in healthcare, and specifically through COVID and after COVID and just currently, what they see day to day. I'm like, how are you guys functioning? Like, how do you just go out and function in society after seeing the stuff that you do? And I actually made a post about this on social media a while ago, how I think all healthcare workers should automatically get medical cards for the trauma and the PTSD that they're going through every single day. And we just don't
Oh, wow.
appreciate them enough in society.
I really support that post. I
Yeah.
might post a similar post. I'm just going to
Please
write that
do.
down. Yeah,
Please
I mean, we're
do.
so. It is funny though that we have like the VA looking at psychedelics and the VA looking at cannabis, and the government has always been the people who weren't supporting and weren't being helpful in the war on drugs, and now it's going to be the government through the veterans that brings some really marvelous alternative therapies to the forefront. Therapies that are going to redirect the entirety of the pharmaceutical industry. I mean, way back when Kessler was in the FDA, Dr. Kessler, he brought everything into big pharma, and doctors used to come up with great ideas and try things. I mean, when I was in medical school, one of the orthopedic surgeons was working on a glue, and he was keeping all of it in the closet under the stairs at his house and thinking about how to make the glues last longer so that hips don't come undone after 10 years. But
Oh, wow.
but then Kessler was like, we're not going to look at what an individual doctor is going to do. You have to bring your drugs from big pharma. What's really cool about cannabis and psychedelics is that it's decentralized, the medical research. It's out there, people are using it, and the FDA is going to like Reddit or pages on Facebook to learn about how people are responding to these medicines. That's just unheard of in the past 20 or 30 years.
I'm glad they're finally listening to people who have been taking these medicines for, decades and healing themselves. And, the Reddit community and these other communities, like, they are so valuable. And there has been peer-reviewed studies that are looking at people's stories from Reddit and from these different websites that talk about these specific substances and drugs as both harm reduction and just like examining how people react to different things, because it's one of the only places that you can tell your full story because it is anonymous and it is safe, that people feel okay sharing their story.
And
So yeah,
back
I
when I
mean,
was in medical school, in residency, they might say, well, some people smoke weed, but they all get lung cancer and they all have heart attacks. But all that nonsense aside, you can't use it, if you're bipolar. You can't use it if you have a history of psychosis because it's so dangerous. It'll make the psychosis worse. And now, just 20 years later, we're using it in studies to treat psychosis and bipolar disorder. And I've had so many bipolar patients over the years tell me that the only thing that levels them out is their cannabis. So we're really getting on track now.
and I'm glad you said that too, because I think another topic is, schizophrenia, which is under that same similar umbrella. But the research is legitimately all over the place. Where in some cases it's showing that cannabis helps people with schizophrenia, and in other cases it makes it worse, and et cetera. So like, I think using an educated person to help guide you in that situation is probably the best thing you can do, instead of just like guessing on dose and consumption method and genetics.
Well,
But
and I
I'm
think you
curious
have
what
to
you have.
remember, that in seizure disorder, cannabis is typically the 13th medications that people try to apply to control their seizure. So don't think that the pharmaceuticals are getting, this marvelous level of control, and cannabis is coming in somewhere down here. I mean, actually, oftentimes when you add the high CBD products to seizures, people see a 50% reduction in their seizures, in the first month. It's very effective at seizures, but for some reason it comes in 13th. And the same thing is true with, when you refer to schizophrenia and I refer to psychosis, it's the same thing. It's seeing or hearing things that aren't
Yeah,
there. So
yeah.
when I'm about to do a prescription for cannabis, I'll ask people, do you have a family or personal history of psychosis? Do you see or hear things? Is there a history of schizophrenia? Because all of that is, basically the same diagnosis with different names.
Yeah.
But being able to help them understand that, and then I'll have people often say, well, there's a history of dementia in my family. you know that's that's no problem, and probably good for the aggressive behaviors associated with the dementia. But yeah, for a lot of people who have a history of psychosis, or an aunt who's tucked away in a home somewhere or something, I talk to them about those varying risks. And a lot of them, of course, by the time they come to get a card, they say, listen, I've already tried it, it hasn't triggered anything. And I don't know if it's the high THC products that may be contributing to more psychosis. I still am on the fence about the extremely high THC products that are available nowadays. I don't like THC limits, but I'm also worried about the very strong stimulation that people get from those high THC products, and that may be part of the psychosis story.
Yeah, I don't think we know the full story, but we do know that too much of anything isn't good for you. And I think there's a lot of benefits in using that full plant medicine and having all the different, substances, chemicals present in that product that helps protect your brain. And it limits the dose that you can take. You're not taking a 99% THC product. You have, maybe it's like a 60% maximum sort of extract. I would agree with that. And I also think it's insane to me that medical cannabis in a lot of situations is not the first line treatment. It's kind of what you're saying, like second, third, 13th. Like my mother-in-law was suffering from probably the worst insomnia I've like ever heard of somebody experiencing. Like she had these bags under her eyes that were like she looked like she hadn't slept in weeks. Like it
Oh,
was really really bad. So she went to her physician about trying, sorry, motorcycle, about trying medical cannabis. And they essentially made her try Ambien first, like
Oh
for
my
sleep.
goodness.
And she was like, I'm really not comfortable with that. Like, I really don't want to take that drug. I've heard horror stories about it. And they were essentially like, you have to try it. Like, this is our first line treatment. And then after, she didn't really take it, but she said she did. And then I made her like this huge care package of so many different cannabis products at different doses, different consumption methods, and I essentially numbered them like 1 through 20. And I was like, start with one, and I gave her this little journal. I'm like, start with one, and then move your way to 20 and see which one works the best. And she only made it to like five, and she was like, this changed my life. Like, this is the best thing ever. And she's
Oh.
still using that to this day to get
You know,
sleep.
I took care of a guy in the emergency room who came in just absolutely gorked, so confused, no focal deficit, like he didn't have weakness in his left arm or a hanging face or anything. It wasn't a clear stroke unless it was, in a different part of the brain where it was just affecting behavior. But he came in after he ran into a pole. I mean, he got in his car for no good reason, ran into a pole, came into the ER, and then about 3 hours later woke up completely perfectly lucid. And really the only thing we could ever come to was that Ambien. But I've had patients eat a half of a cheesecake in the middle of the night with just that, or patients who have had sexual activity with their partner and not have any memory of it at all with it after having taken the Ambien. So yeah, I'm 100% behind a little gummy as your first choice for insomnia. I mean, look at Stephen Colbert. He's always like, everybody thinks all these cannabis users are like, but they're just, some 60-year-old person taking half a gummy before they go to bed.
And that's the story. Like actually my parents were also taking Ambien or whatever, and they would like take just essentially like a quarter of a pill of Ambien before bed. And then I told them, like, I will make you as much cannabis product as you can possibly imagine, whatever you need, if you promise to start weaning off the Ambien. And they did, and now they're like off Ambien and they're just using cannabis too. But I don't think we tell these horror stories enough about these drugs. Like, why are we constantly thinking cannabis is so bad when we have these stories about other drugs like Ambien that are so much scarier, at least in my opinion. But also, I wanted to ask you specifically with what my mother in law was going through and what a lot of women going through, like the menopausal stages, are going through. Is that linked to changes in your endocannabinoid system? And is that something you see a lot, that, menopausal women are struggling with sleep and benefit from cannabis quite a
Oh,
bit?
yeah, I mean, estrogen is primarily an anti-inflammatory drug. So when you go through menopause and you withdraw the estrogen, you withdraw this protective effect of the estrogen, and the inflammation can increase. And so for a lot of women, that's represented by worsening eczema. There can be some inflammation that concentrates in the ears, and people describe it as itchy ears, but you also experience some hearing loss. There's a lot of bone loss that goes on in the first several years of menopause. And there's the incredible sleep disruption with the hot flashes and night sweats. All of that is fascinating, and we still really don't have a good understanding of what's going on with hot flashes. Yeah, but another horror story. My dad got put on Lupron for his prostate cancer, and I like to tease that it almost killed him because it gave him hot flashes. It withdrew the testosterone, and he got hot flashes. And he
Oh
would
my
have to leave
gosh.
church and go, fanning his coat to try to get some relief. And then one day he came in and said to mom in the car on the way home from church, those hot flashes you had? Those are real.
Yeah, it turns out you weren't making that up, and they're very uncomfortable.
So I think my mom almost killed him that day. I know they didn't speak much after that.
Oh my god, that's too much. I didn't even know that happened, so I just learned something new too. Thanks for
Yeah,
that.
every time you mess with the hormones, you can cause some temperature dysregulation. And we think it's just as simple as that there's hormonal, receptors on your temperature sites down in the base of your brain. So when you withdraw those, certainly it makes sense to apply cannabis to the CB receptors in the brain and help to just provide that regulatory. effect that cannabis does. It's a marvelous drug for helping people sleep, and it may help in hot flashes. We have a very small study of patients that were dealing with hot flashes and night sweats associated with a cancer diagnosis, and they got improvement, but it was such a small study that it would really be impossible to take that data and extend it to a larger population.
Still a piece
But
of the puzzle. That's still cool.
yeah, and it helps with sleep. We really know that. There's so many anecdotal stories that it definitely is worth a try for sleep. So I tell patients, to take a Benadryl or take a Zyrtec, which are antihistamines, and they're fairly safe. And then if you do wake up and you're really sick in the middle of the night, you can change your nightgown and you can fall asleep faster because you have this sedating medication on board. So that's true of cannabis too. If you take it prior to going to sleep, even if you do have an unexpected awakening, you can fall back to sleep more readily.
That's good to know. And what I've kind of helped people with too, and I'm not a medical doctor, but what I've, told people with cannabis, if they have trouble getting to sleep and staying asleep, I find that people find a lot of benefit in hitting like a dry herb vaporizer or, smoking a little bit, and that helps them get to sleep. And then they take like a half of an edible or something, and that helps them stay asleep because the effects are
Hmm.
so much longer than smoking. And that's helped like my mother-in-law a lot, my mom, and I'm sure you've seen people that benefit from that regime too.
I advise most patients to ingest, depending on how your home situation is and how you're how what kind of stress level you get when you get home. You might want to ingest when you get home so that you can relax and enjoy your kids and play with your kids or relax into some work you have to do so that you don't feel so constantly stressed, or just try to ingest to where you're less than 1 hour before your meal, because you don't want to ingest and then get hit with the munchies and eat a lot. You want to ingest to where it suppresses your appetite a bit. So either 10 minutes before your evening meal or no more than an hour before, and
Okay,
then
yeah.
and then you eat and you get that fabulous blood sugar insulin program going on, helping you to relax, and your cannabis is coming down into that sedating end of the buzz. And then you're right, you could take an edible and sleep all night. That's my favorite recommendations for ingestion.
That sounds pretty nice. Yeah, for sure. I also I wanted to go back to talking about hormones a little bit because one of the
Mm.
reasons I specifically reached out to you is because somebody had asked a question about how the thyroid gland and any sort of like dysregulation in the thyroid could be maybe helped with medical cannabis in some way. And I still am not an expert in this at all. So I was like, hey, Dr. Clifton, like, you want to, help me
Why
with this
not?
subject?
I
So,
love thinking about metabolism and thyroid and stabilization of those things, and it really is the entire body working together. So if you think about the thyroid gland as with many other glands, you stimulate the gland and it squirts out some thyroid. And if you need more thyroid, then you put more stimulatory on it and it makes more. When the thyroid starts to fail, we measure that thyroid stimulating hormone, because as it's failing, the body is pushing that hormone level and pushing that hormone level, and the
okay.
and the thyroid is not making the hormone.
Oh, so
So
those levels are going to be up, but you're not seeing measurable differences in what your thyroid is supposed to do.
right. So in a failing thyroid gland, you'll see that TSH, the stimulating hormone, high, and then but the thyroid function is low, or it's normal, but your body's really having to pound on your thyroid to get that amount of thyroid hormone out. And then you'll see people start to develop an enlarged thyroid because their body is busy, making more thyroid so that it can respond. But it's not really a matter of the gland being too small. It's that there's an autoimmune process going on, that so that the thyroid may be the right size, but it's really only functioning at 50%.
I see.
So the big
Okay.
Yeah, so hypothyroidism is similar to, all kinds of nerve damage conditions, multiple sclerosis, Crohn's disease and ulcerative colitis, all of these autoimmune phenomenon where the body, directs the immune system at itself. And through a mechanism that I don't think anybody will ever understand, but it's going to be you before it's me because you've got that fantastic science brain. I mean, I went to medical school,
Together we
but I
can
wanted to be
solve
a
all the
bench
problems.
researcher. Yeah, I've always wanted to do research, so I'm a little jealous of you, Riley. But
Uh,
especially when you guys are in the lab with all the Bunsen burners and the beakers and everything. Man, oh man, that gives me FOMO.
it is
But
pretty fun, I'm not gonna lie.
oh, for
I've had
sure.
some fun days in the lab.
Me too. I mean, I wish it was still in my life. But patients are fun too.
Oh, I'm
But in
sure.
any case, the thyroid, for however this is working, the cannabis seems to be impacting the gut systems, and specifically impacting Akkermansia muciniphila, which is a particular bacteria in the colon. So it's changing the microbiome of the colon.
Interesting. That's really,
Yes.
really
And
interesting.
then we know that all of these diseases, or so many of the diseases in our body, come from the health of the gut, and certainly autoimmune phenomena are heavily regulated by gut health, and a lot of movement disorders like Parkinson's disease, and they're finding triggers because the gut has this huge collection of nerves that just looks like a spider web coming up into through your chest and through into your brain, the vagus nerve. And so the brain and the gut are communicating all the time. So it may simply be the relaxation that's derived in the brain that's being delivered to the gut on this two-way system, the vagus nerve. Or it may be that CB receptors on the nerve itself. Who knows? But
But it
that a cancer,
so it
Akkermansia muciniphila. I had to write it down because
No,
that's a
yeah, I would have had to write that down too. So maybe that microbe is like pro-inflammatory, like it's causing additional inflammation, or maybe it's just throwing off the balance of the microbes in the gut that's leading to this dysregulation that we see in thyroid conditions and Crohn's disease and IBS and these other conditions.
Yeah. The gut microbiome is part of all of that autoimmune in a way that I don't think anybody understands. It's not that I didn't prepare for your podcast. We just don't know beyond some changes in some bacteria in the gut, and this particular one being one that's very important. So.
That's really interesting. Yeah. I mean, I didn't know that. So thank you for sharing. And we know that a lot of medical cannabis patients who do have, some sort of inflammatory gut condition benefit a lot from cannabis. And maybe they haven't seen benefits in any other form. So I'm just curious, if you, as a physician, have recommended any like specific products or even consumption methods, because we also know the gut is lined with cannabinoid 2 receptors, which are specifically involved in inflammation. So if you do have some inflammatory system going on, even like a terpene like beta caryophyllene, which is that peppery smelling terpene, it can actually directly activate those CB2 receptors and help with inflammation. So, just based on that science, I try to help people by directing them towards products that have CB2 agonists like beta caryophyllene. But I'm always wondering if smoking's the best thing, or is beta caryophyllene even in the same form after we smoke it? We don't really know. Or,
Right.
should we be taking like a tincture or an edible or even a suppository in cases with IBS and inflammatory gut conditions?
Well, I mean, the gut is very responsive to what is moving through it. So I always encourage people with inflamed guts to eat highly nutritious food
Yeah.
and high fiber food so that the gut has all the nourishment it needs to, because a high fiber diet increases blood flow to the gut by up to 30%. So and the gut wall increases in thickness. So you have a much healthier gut with a high fiber diet. The question of how to appropriately deliver the drug it's a great question, because if you biopsy, the other thing I wanted to say is, if you biopsy somebody with skip lesions, when you have like an ulcerative colitis or a Crohn's disease, you'll have clean gut that's not affected, and then you'll have a lesion, and then more clean gut.
Is that
And
the
if you
same
buy
as like leaky gut, or is this different?
No, this leaky gut's a
Different.
little
Okay.
different. I
Okay.
mean, a highly inflamed gut has the potential to just not process foods correctly and let some partially digested proteins pass through that can then stimulate an autoimmune phenomenon.
I see. Okay.
And yeah, yeah. But this is different. What I'm thinking about is, like, if you have a canker sore on your lip, and you've got the canker sore, and then you've got all of this healthy tissue around it. If you were to take a punch biopsy, just, and take a circle of that, where half of it is the canker sore, half of it is the normal, you actually see increased CB receptors on that canker sore. Your body is doing what it naturally does. It's trying to bring anti-inflammatories to that area from your naturally functioning endocannabinoid system. So you're going to see that all through the gut in people with serious gut conditions. I would encourage smoking with gut conditions, because
I love you.
because well, if you love me so much, why don't you marry me?
Wow. Maybe we'll have a live episode. We'll get married.
Okay. In your garden.
Right?
Oh,
Oh my
you're
God, a
already
little
married.
fairy. Yeah, I am already married. I actually don't know if you're allowed to marry multiple people in New Hampshire. Who knows?
Well, check on it. Let me know. But
Okay. Sorry, keep going. It's just so refreshing to hear a physician, a medical doctor say, yeah, you should be smoking for some conditions, because usually it's like, oh, take an edible, or like only dry herb vape. And like that's fine for some people, but we have evidence that the majority of medical cannabis patients prefer smoking as their consumption method. And we can't ignore that number. Like we cannot ignore that
no.
80% of people prefer that. There's a reason they prefer it. That's not just rapid onset. It's unique
Right.
chemistry, and it has unique therapeutic effects. And we have to listen to our medical patients.
And
So
we
yeah,
don't we
please.
don't have any proof that medical patients are suffering by smoking. I mean, you're not talking about smoking a pack of cigarettes with 250 inhalations in one day. You're talking about, like, I don't know, 3 or 4 inhalations a day for most people, which is very doable and very well tolerated. And then and so it's a totally different thing. And you're inhaling pro-inflammatory products versus anti-inflammatory products. But even if it does set up a little inflammation in the lungs, the population-based data doesn't support that over time that hurts you at all. And there's research that shows that people with ulcerative colitis or Crohn's actually have fewer outbreaks, do better with their disease if they smoke tobacco. So there may be something where a small amount of inflammation somewhere else sort of redirects the immune system, so it goes and handles that and it quits bothering your gut.
I've
So
actually I've
that's
actually
something.
read the study that was talking about like smoking tobacco products being helpful for autoimmune conditions, and I shared it. Just I think it was on like a TikTok comment that I just like slid it in there, and people were like, "What was that?" And I'm like, "Yeah, I'm not going to make a video on this because I'm not trying to like boost up the tobacco industry, but it was interesting. It's an
It is
interesting little
interesting,
snippet."
isn't
Yeah.
it? But back not even that long ago, I was going to say hundreds of years ago, but probably 100 years ago, we didn't have, clean water and clean food. And we routinely had parasites and tapeworms and stuff we had to deal with in our water and in our food that our immune system was in charge of. And now that same immune system that doesn't have anything to do, that's just kind of sitting around because we fired
Waiting.
it with our
Yeah.
with our clean water and clean food, that's the one that's causing all this havoc with allergies and gut problems.
Yeah. So yeah, I mean that's God, that's interesting. So you would recommend smoking specifically. Is that because of the rapid onset, or is that because it's just like help? It just the data shows that it helps people with these inflammatory gut conditions the most.
Yes and yes. Yeah. Yeah. The
Okay.
rapid, true. Because you're not, as much as the gut is responding to what you put in your mouth, and what you put in your mouth is extremely important. What you're
Yeah.
eating for food, that's, I think, the most important thing. But the outside of your relationships and your intentional intention to be loving and kind, and live your life that way. But what goes in your gut matters, but really the gut is fed by the blood supply. So
Yeah.
if you want to get this drug into the blood, and not have it pass through the liver and change form at all as like an edible, I mean, this is a drug that has been intended to be smoked. We've been drying it and smoking it since, Egyptian times at least. Is that how far we
Exactly.
are back? It's
Oh yeah.
thousands and
At
thousands of
least.
years.
Yeah. Yeah.
So
I
it's
mean,
a good thing to do for your body. It's not going to hurt your body to smoke a little bit each day.
yeah, I'm glad you said that because it's really not comparable to cigarettes, as you're saying. Like when you're, chain smoking all day long, it's very different if you're smoking like one joint or you're taking a bong rip in the morning and a bong rip in the afternoon. Like it's really not the same, and we don't have the same data as far as like carcinogenic effects and lung cancer rates. We just don't have that evidence, and we would if it I mean there's enough people smoking weed that we would have that correlation and that data by now, at least in my opinion.
So much of the data is just if somebody comes in and they had an unexpected heart attack, some guy in their 40s, it's not some 60-year-old guy who's been dealing with cholesterol for 20 years. Whenever somebody comes in like that and they've smoked any time in the last week, they're like, oh, cannabis caused a heart attack. And then, and it shows up in the medical literature. But when they've actually gone back and gone over that literature, they're like, none of this it isn't as though somebody smoked and then they had a heart attack, and it's this very clear one-to-one. They're also eating a bunch of those flaming red Cheetos and never exercising. And
Oh, I know. There's always confounding variables. We just really love to like pick at the sexy ones that it's going to
yeah.
cause like, huge story about. So that's hilarious. Speaking of other like inflammatory things happening in the body, I feel like endometriosis is a condition that a lot of women are using medical cannabis for, and it doesn't really get that much attention. And I've actually seen, I think there was a company that was working on putting either CBD or THC, I forget, maybe a combination, into like a tampon so that it's essentially like a suppository, but it has multiple different functions in this case to help
hmm
people with the severe pain associated with endometriosis. And a lot of women in pain just don't get the attention that they deserve because for some reason women are just supposed to like grin and bear it regardless of how much pain they're in. But I was wondering if you could talk about that and maybe describe like what endometriosis is and, if you've worked with that at all.
Yeah, endometriosis is so difficult to manage. It causes very painful, crampy, uncomfortable cycling. And what it is little pockets of the endometrial tissue that are growing outside of the uterus. So you'll get a little patch of it on your gut or on the wall of the abdomen, places that are very richly innervated. So when it goes through the process of sloughing off each month, it creates quite a bit of pain. We used to be able to, I mean, we still do go in and laser the endometrial patches so that, that's intended to reduce the pain, but that's abdominal surgery, even
That
with
sounds painful in
laparoscopic.
itself. Yeah, it's all
Yeah,
painful. Yeah.
and it can lead to scar tissue, so then you get these bands of scar tissue, and that causes problems down the chute also. So, finding better ways to manage the pain. I've gotten great results with high THC cannabis products for those types of persistent painful syndromes where you need to dissociate a bit.
Yeah.
And I've had a lot of patients get really profound reductions with avoiding omega-6 fats and animal proteins around the time of their for the 10 days or 14 days around their cycle, like the 10 days before and the 4 days during.
Interesting, because they're inflammatory, or
Very inflammatory, and they
yeah,
do
okay.
seem to be like, especially, the omega-6 fats are, they immediately go into the prostaglandin, into producing prostaglandins, not the healthy prostaglandins that protect your kidneys and your stomach, but the prostaglandins that break down into cyclooxygenase, which is stimulates asthma. It stimulates, these endometrial painful episodes. So, getting going to vegan proteins, which has never been easier, and avoiding any, deep fry or any, unhealthy fats, and replacing those with olive oil and avocados and nuts for half the month is going to just make you healthier in every way, but it also is very healthy and helpful for the endometriosis sufferers.
That's so cool. I didn't know that. And, I've been learning a lot about my body recently. I don't know if you've seen these Aura rings, like
Yeah,
OURA. Yeah, so
yeah.
I recently got one of these as like a non-hormonal form of birth control. It's like FDA approved, and it pairs with an app called Natural Cycles.
Uh-huh.
NC is like the little symbol, but it's really cool. It lets you know like what stage your body's in, because it takes a temperature of your body in the middle of the night, and then it can predict your fertility based on that temperature. And there's like
Huh.
a lot of science behind this, but I will admit that I was like relatively uninformed about about my body like through these different cycles. And now I'm like checking this app like social media. Like I'm learning about my body every day. And it's pretty empowering, I'm not going to lie, to not just like I feel like I was very blinded for a long time, but unfortunately, like this isn't the most accessible form of learning in birth control either. It is kind of expensive. You do have to pay like a monthly fee for like the app. So unfortunately, it's not super accessible. But I would highly recommend for anyone who wants to learn more about their body and predicting when you're in these different cycles and when you're fertile and when you're not fertile. The Aura Ring has been it's been really cool.
Well, I'll tell you what, when I was in elementary school, we used to get like 2 weeks of human biology at the end of the year, and I always was so excited when we'd start learning. And then when I got into undergrad, there was a little bit more biochemistry, physiology. I have an undergrad physiology degree, but then when I got into medical school, I was like, this is fantastic. No more government, no more literature, no more anything. It's just science on the human body all day long. And that's the way it has been now for 25. I mean, I'm just so happy in medicine, and thinking about it is just endlessly fascinating. And then this interception between tech and biology is a
It's
fascinating
it
intersection.
is great, and I've never ever had a smart like watch. I've never had like anything that's on me that tracks anything I do. But full disclosure, so I recently was at a psychedelic conference in Vermont, and I took MDMA. For in like a very therapeutic setting, like it wasn't in a party setting at all. I wrote this whole thing up on my Patreon about it, and I'm probably not going to put that on other platforms because I don't know if it should be completely public. But this was tracking my metrics of like my sleep quality and like my heartbeat and all that stuff like throughout the night. And it was hilariously different compared to like a normal day. Like, just like all my metrics went down as far as like your quality of sleep, your heart rate like went up, like everything. I'm like, this is kind of cool to track your like dosing schedule and how it affects your like body's physiology and heart rate and all the fun things. So for me, it's just kind of cool because I know when I dose certain things. So now I can like look back and be like, oh, well, this is what my body was going through at that time. And I can kind of like track this in real time.
That's really fun. There's been so many tracking tools devised over the years with the smartwatches and everything. And then there's been these dosing tools that came on the market where they wanted to, monitor your dosing and determine which medicine goes with which disease. So they could say, if you have insomnia, you should use an indica leaning hybrid, with these terpenes. And then what they really found, which I think is so powerful and so brilliant, and just such a evidence of what the earth is willing to do for us as humans, with cannabis, is that there's no association. Like half of the people in California who are using, at one dispensary at least, who are buying weed to sleep, are buying a sativa, not an indica. And there isn't, so the Afghani strains and the African strains and all of the different fantastic hybrids, when people say, which one should I use for my particular condition, use the one that you are willing to smoke, because if it makes you miserable, you're not
Oh,
going to
I love
use it.
that. Yeah, and that goes back to like the nose knows, like why every
Yes.
dispensary should allow you to smell the product, because I
Hmm.
can smell weed and be like that's going to make me tired, and I can smell weed and be like that's going to be stimulating, because we also have plenty of peer-reviewed studies and literature showing that even if a product is labeled as indica, that doesn't really mean anything. Like there
Hmm.
it could be a very uplifting strain. It could have terpenes that are known to be uplifting. There's really no regulation on what a dispensary or a manufacturer needs to put on that label according to like the chemistry. So you really should just trust yourself, because you are the best person, the best metric for determining the quality of a product and how that product's going to react with your body. And all of us are different. We can't even, if it was as simple as indica sativa, like we still wouldn't have like we still couldn't make huge claims about how a product's going to make you feel, because we really react differently. Different doses, different products, like we're all going to react differently. So and it's also unfortunate because like cannabis products are expensive, and we're always like trial and error, like try a bunch of stuff. Unfortunately, that gets like pretty expensive for some people, and it's like you can't always afford to try 5 different products and see which one's going to make you feel the best.
But I think you can also really rely on the tried and true products. I mean, wedding cake, gelato, Girl Scout cookies.
Jack hair,
I
same
really,
every time. It's awesome.
everybody that I know that has used any of those products likes them. They say, "Oh
Yeah.
yeah, that's a good one." So you can go to those tried and true ones and just relax into those, and you're almost certainly going to have a good experience, rather than showing up with a list of terpenes you have to have and a percentage of THC and indica versus sativa. Just yeah, show up with a list of the tried and true favorites and smell them, and then
Yeah.
buy the one that suits you.
Yeah. I love that. Have you ever heard of somebody getting violently sick from like a 5 milligram edible or a 10 milligram edible? Like I've had
I've heard of
somebody
so
told
many
me.
people get sick from edibles, but it's
I
usually from
know.
like a too much.
I know, and I had somebody who was already kind of baseline anti-cannabis, come up to me and say, "Oh my God, my neighbor took a 10 milligram edible and she was vomiting all night long, and et cetera." And I'm like, I don't know why that would happen unless she was like allergic or something to like something that was in that edible. I don't see like THC causing that, but maybe there is a tiny, tiny portion of the population that reacts that way. But I'm like, I don't know what that means. Like, send me a picture of the package. Make sure it's not like a sketchy Delta 8 product that might have something else in it. But yeah, after that, I was like, I mean, I'll check. I'll check with medical professionals like yourself. But I've never heard of that happening to other people.
Yeah, no, I haven't heard of it at 5 or 10. I mean, there's a number of issues that could have happened there, but my leading guess is that it was not a 10 milligram, that it was somebody who sold them a 10, and and for whatever reason the testing didn't wasn't effective at really identifying what was going on there, or maybe they were just told it was a 10, but they didn't actually do any type of confirmatory things. So many people I know have, I mean, everybody I know who has used an edible has a horrible edible story. So,
Oh
and
yeah.
my biggest advice to people is to really honor the edibles and be very, very careful with your dosing. The onset of action is unreliable, anytime between 30 and 90 minutes. And then you don't know how hard it's going to hit you based on what else was in your GI tract. That's why I love inhalation so much. Take
Me
an
too.
inhalation, check your watch, and in 9 minutes you're going to know how that inhalation hit you, and if you're ready for more, then take more,
Yeah,
and keep it, and then keep resetting the timer on your watch or your phone, as we're all doing nowadays.
I
And
know, right?
before you know it, you'll know exactly what you need. Like, patients will tell me I'm typically one puff, but some nights I need as many as three. Like, Monday nights are really high dosing nights for a lot of people. They're freaking out. It's been a
Yeah.
rough day. And Sunday nights are big dosing nights too, because you've got to start your week. And I mean, Sunday night stress is real. When I was in medical school, they would say people come in with chest pain all the time into the ER, and chest pain is an internal medicine doctor's bread and butter. But they say the people that come in on Sunday night, those are the real deal. Those
Mm.
are the hardest, and that has happened to me so many times. That somebody that comes in the ER kind of looking still like a rose, nothing really showing up, then a few hours later they're crashing with a big heart attack. So it's a those Sunday night,
Whoa,
yeah,
Sunday
Sunday night
scaries
scaries.
are,
Yeah,
yeah, they go, wow, I didn't even think that how that could be related to like heart attacks, but that makes
yeah.
a ton of sense. And it's important to also what you're talking about, dosing different days of the week. We're starting a study soon that we think is going to probably be like the largest medical cannabis study. Like for 2 weeks, we're going to track people's like use patterns, and I think we're going to see huge differences in the beginning of the week versus the end of the week versus the weekend. Like
Hmm.
my weekend patterns are like I'm always stoned on the weekend. Like I'm just riding that high like the whole time. So it's like, and I'm gonna fill out the whole thing too. Like I want people to feel comfortable sharing stuff, and like I'm happy to share my entire 2 week schedule. So I'm really, yeah, I'm looking forward to that. I think it's going to be cool, and you can fill it out too if you want. I'll send it over to you when it's
Usage
out.
patterns do correlate with different times of the week and different stress levels, but I don't know of any research that actually quantifies that. So I'd be excited to read that research and see, what people are saying about how they're using it. But I would agree with you. First part of the week, people are going to use more. Sunday and Monday are tough days. But
Yeah,
the thing to really take away is just to use what makes you feel good. Don't feel an obligation to try to smoke a particular product, or use a particular edible because of its terpene focus, or because of some other thing that's being touted by it. Just choose the oldies but goodies, and then follow your nose.
yeah.
That's very good advice. What you said, you should be able to smell it.
Yeah, and I mean, I will literally pick dispensaries like I will travel further if I'm buying from a dispensary. Like I will travel further to a dispensary that I know I can smell a product versus one that's closer and you can't, cuz it's like it's a part of that experience for me. Like I'm going to try, I want to smell 10 different things and like say, "Oh, that one's not attractive to me. That one's really nice." And of course, like the beauty of the nug, like that matters too. Like I want like a big beautiful nug. I don't want these like ugly crispy little tiny ones, I
Yeah.
that matters to me, and it might not matter to some people, but to me that correlates to quality, and I think we should be able to see that product in that form.
Absolutely. I think you should be able to see it and smell it. I love traveling. When I travel, I always go to the pharmacy and check out what other countries are doing with their pharmacy. But, there's not a lot of countries where I can pop into a dispensary. I tried to do it in Spain this summer, and they wouldn't let me in. You have to be in. Yeah, I mean, it's a process in order to access the dispensaries overseas as a foreign person. So
Mm.
that's difficult. But I've been in a gajillion of them all over the U.S., and I really enjoy that experience, seeing what people are doing. There's the Dunwinnie Farms in Aspen. Is, oh my God, what a fabulous experience with
Ooh,
these
I want to go.
beautiful. diamond necklaces with $40,000 price tags, with
Oh my God.
cannabis. I mean, they are really fantastic. And they have so many neat, really, really cool bespoke products. It's a horse farm that converted to doing a bit of cannabis. That's probably my favorite dispensary in the country.
Oh, I love that. I hope I can open a dispensary someday. I'm like, we're working on like having a recreational market in New Hampshire. Like, I'm part of the New Hampshire Advisory Board, and I'm just like waiting. Like, I'm just waiting for the moment that I can open a
Waiting,
dispensary.
waiting.
Because I think you can make it
Oh,
a whole experience. Like, it doesn't have to be like this corporate cannabis thing that you see a lot. Like, actually, even when I was in Michigan, I went to a few dispensaries that had great vibes, and you could smell the flower. They had $59 ounces, which I didn't buy any product, but I was expecting them to be like really ugly and smell bad, but smelled great. It was a beautiful flower, and I was like, that is shocking. I would have like never thought that a $59 ounce would actually smell good. I thought it would be like really old and crusty.
well, there you go. I mean, you often get these really marvelous dispensaries doing something super cool and in the middle of nowhere. One of my other favorite dispensaries is Big Rapids, Michigan, and I know the dispensary owner so well. We've had dinner together multiple times. He's such a great guy. But he was based in Ann Arbor, and then he relocated to Big Rapids, and he does this drop the top where he works with a grower to grow really, really good top shelf product, and then the grower knows that this entire crop is going to sell, and so he every single day he does a drop the top where he features this super great cannabis at a really good price, and he gets a good price with this negotiation with the grower, and then he has people come in every day, these regulars that come in every day for the drop the top special. And so, I
Wow,
mean, what
I
a
would go in. That
brilliant
sounds
idea.
great. Yeah. You got to be creative in this industry, and it's like those are the people who are going to win in the end. Is you got to be creative, and you got to know what people want. People want high quality products, and they want smokable products, things that have been dried and cured properly and that are just like really smooth and nice and unique. And it sounds like they're doing a really good job of that.
And then I think if you're smoking, just you can do the dry herb vape. That's a good choice. That does appear to decrease carcinogens. If you're using any other smoking tool, just make sure that you really source it properly, because you're not just getting the cannabis, you're also getting, whatever contaminants might be in the glass or, might be in the clay. So the stainless steel products I really love, and I just, it's a very important to source those products, clean, and make sure they're as clean as they can be for your health.
And clean your bong water. Change your bong water. Like it'll
Yeah.
only take a minute. Just change your bong water every single day. Every single day. Also, I had
Hmm.
another question because I have your book right here, which is great.
Thank you.
Yep, I was reading this actually today just to prepare for this interview and stuff. But I've talked to other medical professionals and they said they've really learned nothing like during medical school about the endogenous cannabinoid system, the ECS, or just medical cannabis in general. So, I mean, this book is really well written and you obviously know a ton about medical cannabis. So like how did you learn about it? Like, what was your process? Did you learn anything in medical school or are you self
Well,
taught?
you asked me about my process, and then we started talking about something else. But I'm sorry, I have a smoothie being made downstairs. I'm sure you, you can hear that. But my patients just kept talking about cannabis and how it was helping them go through a hospice process, or how it was helping them with chronic pain. And I just kept trying not to hear them and not documenting it, because I didn't want to put them under any risk with their medical chart. And then when my brother died, he had a very, very high anxiety, very difficult death. And I did everything I could with the existing prescription therapies, but it was not effective.
Hmm.
And that death really stuck with me, because I wondered how many other people, despite our best efforts, have very uncomfortable experiences. And then that led me in a path to thinking about cannabis and psychedelics. I think, his outcome would have been vastly different, his experience and his family's experience. And my experience and the trauma I endured with it would have been better if we had been able to dose him. So I really started thinking that was about coming up on 8 or 9 years ago, and then as you can see from that book, once I get into something and I start thinking
Oh, I
about it,
love it. I
I get it.
do.
I think about it for a long, long time. I love to. I mean, I don't know. Medicine has been. It's what do they say? It's a greedy mistress. I'm always thinking about patients and always thinking about medicine because I love it. It's fun. So that book and thinking about it just became. I read everything and read a bunch of studies, and then I shot almost 3,000 videos that I house at cbdandcannabisinfo.com. And I have
Wow,
a, and I have a,
3,000 videos? Oh my god.
yeah, I just went through all the medical conditions that I wanted to cover, and then shot videos explaining the condition and explaining how cannabis might work with chronic pain in the spinal cord and how it works in the brain. And
Wow.
there's 3,000 more videos to shoot. There's so much data,
Oh, of
but now I
course.
just shoot new stuff on TikTok. But yeah, I shot that video compilation, and then built a coaching community, and then moved more into manufacturing and production support and card preparation. And so I haven't been too busy with the coaching community lately.
Well, that's still incredibly impressive, and I mean, I shooting 3,000 videos, like, my entire TikTok, I think, is, like, 350 videos, and I've been doing that for, like, 2 years.
350, is that all the videos you have? It can't be.
I think
'Cause
so.
how many do you shoot a day?
Oh, not many anymore. I only shoot videos when I'm inspired. Like, I cannot make myself make content when I don't wanna make content.
Yeah.
So, some weeks I'll record 5, and then some weeks I just won't record any. But, yeah, I definitely have less than 500 videos, so 3,000 is, like, so impressive. That's amazing.
Yeah, it was a huge endeavor, but we really needed to get a repository together of the information that people needed. But it was way back when I was still, I mean, all the videos have the same background. I'm in my white coat and my hair is just exactly
People
right.
love that though. Like, they know
Yeah,
they can trust you. You are a medical doctor, and it's okay to present yourself as one. Like, that makes people feel comfortable. And I
yeah.
mean, that is a ton of work recording all of that. But what's important too is, like, that's how people learn now. And I think a lot of times when
Mhm.
people are like, why do you always, make your content on Instagram and TikTok? It's like, that's where people get their information, is through short form video. Like, that's how people
Yep.
learn the best. So, I mean, I'm a nerd and I love reading books, and I, like, love reading textbooks, and I know I'm in the minority there. But so this is a great resource for someone like me, but it's also amazing that you have other resources for people who prefer to learn in different ways, because we do all learn differently, and this information does need to be accessible for different age groups with different, accessibility needs. So it's really cool. So shout out to you. That's huge.
Oh, well, thank you. Yeah, I've written 5 books on cannabis. I wrote that one, and then I wrote another one called "The Grass Is Greener." That's more of like a patient vignette, and then like a smoothie and a dog, because my dog needed chewies, and he didn't have teeth. And so he's living with my sister now. But when he was with me and he's very, very stressed. He has terrible stress and anxiety. So he went to live with my sister because she doesn't travel as much as I do. But he, anyway, had to have chewy treats, and I couldn't find any CBD treats that were chewy. So I hired a chef and then created this book around it. But if you join my email list at cbdandcannabisinfo.com, then I send all those books as part of the downline, so that you can make some really yummy smoothies. Or smoothies are pretty easy. I mean, but I'm a cook, and so you put a little squirt in and you're in great shape.
I
But some
love the
people.
subliminal marketing with the smoothie going on in the back, and then you talking about smoothies.
Well, I'll tell you what, my boyfriend is not a healthy man. And he's I mean, he likes to eat rich foods and he likes to party. And so I've been like, these it's a nudge, but the smoothie was a good nudge because now he eats a great big salad and a piece of fruit every morning, and he just eats it without even thinking about it. He misses it when he doesn't get it. So I made them for him for months. Now he's down there making his own. So
That's cool. It's
yeah.
cool seeing, people make changes in their life just based on what you've, helped them kind of understand about health and well-being. Because a lot of people do need, they need education on how to make a smoothie. Things like that might be really simple to you or me, but if you've never made a smoothie or you don't know the nutritional value of a smoothie, why would you make a smoothie? Like, why wouldn't you just eat a granola bar,
Yeah. And then
So,
if you're making it, then stop and think about what you can do to make it a superfood. Can you put in a squirt of CBD? Can you add some other things? But really, just some kale and spinach and frozen diced mango and a banana and some orange juice, and that's an amazing combination of food to eat every day.
yeah.
If that's all you do.
Yeah, and I like putting smoothies in bowls with like some chia seeds on top and like some other nuts and stuff. Because if I
Oh
just drink a smoothie, I like funnel it. Like I drink way
yeah.
too fast, and I need to slow down. So I like to just eat it with a spoon to make sure that I'm like really enjoying every bite of it, and I'm not just like slurping it down like a
Yeah.
cup of water.
You're so funny. That's the biggest problem with smoothie people is that they chug it, and then you get these peaks in your
Yes.
insulin. And I have a few patients that follow this French nutritionist that believes you shouldn't chew your food, so they do all of their food as a smoothie. They do all, and then as a consequence, they eat all of these fruit and vegetable smoothies, and most of them, weirdly, after years of doing this, have blood sugar issues. So there is something. What you're doing is very smart to back it off and sip it, if you will, from a bowl rather than chugging it. So because they
Well,
are
and
easy to just.
And I think just slowing down when you eat, it's something I've been working on for a long time because I think whether it's like you're eating in cafeterias or at work when you have a lunch break, like we're always just trying to like eat fast, like just get that in our bodies and then like move on. But like I always talk about food as medicine, and part of that is like enjoying your food and enjoying the process and like taking a second to be like, okay, we're not working. We can actually just sit here and like enjoy every bite of this. So, and I've had eating disorders in the past, so like I am just like always focused on respecting that food, respecting that nutrition, and like it's always a constant battle, but it's good.
Mhm.
It's healthy to like be hyper aware of that in my situation at least.
Yeah, eating is very difficult for me too, and I do tend to approach meals with a little fear and anxiety, and I need to transition that more to respect, because that's a great way to think about it, because we are so lucky to have all this amazing wonderful food, and then there's the backlash of being so lucky to have all this amazing wonderful food.
Yeah, and I mean, part of like why I do a lot of like homesteading and like I grow a lot of food is that's part of the process of respect for me. It's like I like to be part of that whole process because I'll never waste food either if it comes from my garden. Like I make sure that I'm, either preserving it correctly, or if I don't eat a full meal, I'll just like put it in a to-go thing and eat it the next day. And that's definitely helped me too, and that's part of that, therapeutic journey. And people ask me about like eating disorders and cannabis a lot, and I don't really know what to tell them because it's a really, really personal, like not just like personal for me. I'm saying for each person it's different because in my opinion, if you suffer from something like binge eating, the munchies might be the worst thing in the world for you. Like that might be the most triggering thing. If you
Hmm.
do if that's already part of like, how your brain wires. So I
Yeah.
think in those situations it's not a great thing. But if you have anorexia and you struggle with wanting to eat food and enjoying food, in that case, I think that cannabis and the munchies and that, satiation could be a positive. But I would never put out a blanket statement and be like, cannabis is great for all eating disorders because like that can be it's a very delicate subject. It's definitely not something that you can just put a blanket statement over.
Yeah, yeah. Eating disorders, I'm afraid, just have a very complex treatment protocol. But I do think it's important. You know, there are a lot of foods or food-like substances, I like to say, that really should never be eaten. And the whole idea that, eating disorder people need to learn to eat the entire variety of food. It's very okay to have a restricted menu that's restricted to healthy foods and foods that support your healthy digestion and healthy lifestyle. I mean, I don't want anybody to ever eat a donut again. I mean, a donut is something you could maybe eat once a quarter when you really want to treat yourself, but no more than one or two or three donuts a year, if that. I mean, that's a non-food that's doing nothing but damaging you. So I hope you don't have a donut sponsor that all of a sudden.
I do not have a donut sponsor, and it's funny you bring up donuts because donuts are one of the like quote junk foods that I really can't eat. Like my body like rejects donuts. I don't want to get too graphic here, but I do
It's
not
just
react
too
well to
much.
donuts. Yeah,
Yeah, and I
there's
mean
too
that
much.
that is like if you want to do everything you can to inflame yourself and get your Akkermansia muciniphila just rocking, right? I mean it's processed, ultra processed grains and fried in omega-6 fats. That probably have been sitting there for 25 days because they're made to last in the fryer and then covered in all of that sugar. It's a terrible choice. So yeah, I mean, I think some self-imposed dietary restriction is going to keep you uh, not only with an easier weight management problem, but also prevent a lot of chronic disease and all of the negativity associated with that because it adds up. And all of a sudden, you're like me, you're 54 years old, and things are not what they were when you were 25. I mean,
And I mean, what you're saying too, it's like it is a balancing act. Like you can have a donut once in a while, but you just, you need to be aware that you're not providing nutritional value when you eat that donut. Like that is more of just like a treat that you're going to enjoy. And you
mhm.
can't do it every day. And especially the, the modern donuts that are like as big
Oh
as
my
my head and then come with like a cookie and like a syringe of like frosting. I'm like, why are we doing
God.
this much? Like
Yeah,
I don't
everything in
understand.
moderation. Everybody says, oh, everything in moderation. But no, actually, no, because if you're moderating shakes and hamburgers and cookies and hot dogs and pizza and all of these really, and you eat them all just once a week, you're going to die. I mean,
Well,
that's just.
no, but it's also important back to like relating this back to something like an eating disorder too. It's like you have to realize that those foods you're eating are also influencing your mental health. And when you do go back to an eating disorder, that's 80% your mental health. Like it's really a battle of your brain and what your brain like
Yes.
thinks it wants. It is an addiction. Like you have that addiction pathway when you
Yeah.
have disordered eating. So
Yeah.
it's like you need to retrain your brain. And maybe at the start, that is a really stringent diet. Like it kind of has to be if you're
Yeah.
rewiring your brain. And then in the future, you can start to add in these like treats and these and start deviating from that further. But it takes months, if not years, of like really learning what are your triggers, what is a positive thing for you, what makes you feel satiated, what makes you feel comfortable. Maybe you can never ever go to a buffet again. Like that might be something that you just need to learn about yourself, and that's just something that if you used to suffer from disordered eating, maybe that's just an accommodation you do now. You just don't go to buffets anymore, and that's okay. Like it's
Yeah, I
okay.
mean, because remember that your gut is linked to your brain through this very
Gut brain
powerful vagus
axis.
nerve, and the brain is linked to the gut. So the brain is telling the gut things, and the gut is also telling the brain things. And that's where I mean, that's where I think cannabis is very powerful because everybody gets hungry at meal times. If you're trying to
Yeah.
control your weight, you arrive at meal times hungry, and that's great. It's good to be hungry. It releases anti-aging hormones. It's really helpful for you're not going to be like naturally thin unless you're comfortable spending several hours a day having a little bit of a hunger pang in the background. But if you smoke, within an hour of sitting down to your meal, it slows the GI tract function. So people with constipation may experience worsening of their constipation, but in general, if you're eating a healthy diet, that's not a big issue. But it will also give you that sense of fullness that lingers because the food stays in the stomach longer.
Yeah, okay.
And so you're not going to eat as big of a meal. If you smoke and then you let it go for a couple of hours to where the brain chemistry starts to create that munchy thing, and then you're just off and running. God only knows how many calories you might consume. But if you can get that, and it's different with different people, but I think within an hour of smoking, you can get that magic vibe where your stomach is responding to the food a little better. You're really relaxing and enjoying your food and responding to it in a smarter way. You're not just rushing yourself through it. And it's
Yeah.
a very good position, I think, for helping people have healthy. Well, people who smoke cannabis regularly over their lifetimes, right, maintain ideal body weights at a much higher rate than people who don't. So
Yes, I
there is
made a
some,
video about this that was very controversial. It was
yeah.
yeah, the comments were crazy. People refer to it as the skinny hippie hypothesis. How people like stoners tend to be thinner and have less body fat. And I guess part of this is just, mouse studies and rat studies that are confirming this right now. But when you start using cannabis at a younger age, it
Mm-hmm.
actually changes the way you process fats and how you store fats and the different parts of your body, and that has lasting effects like throughout your life, for how you're storing fat, and it's not necessarily a good thing. It's like a flip of the metabolism in some way, but I mean, obviously that the internet's obsessed with being skinny. So everyone was like, "Oh my gosh, I should start smoking at 12." I'm like, "Whoa, that's not what I was trying to say with this video."
Yeah, the fat deposition data is interesting, and I'm curious about that because on my initial read, it would suggest that you're more effective at depositing fat if you use weed regularly. But the population-based data is clear that that the skinny hippie is a real true phenomenon that exists, that smoking over your lifetime keeps your body weight low. I don't think that we've been able to show that starting smoking at a particular time drops your body weight. But I haven't seen a good weight loss program with it except for the
No.
THCV.
Yes, and that THCV is very, very interesting because I mean, it works kind of in an opposite way as THC. If THC initiates hunger, THCV kind of prevents hunger. But we also know that the drug Ramonabant did the same thing, where it like essentially worked in the opposite way as THC. But that made people suicidal. But we don't see that trend with THCV. So it's obviously working in a slightly different way or maybe less strong, by like acting on those CB1 receptors in kind of an opposite way as what we're used to seeing with these other cannabinoids.
Yeah, the different individual cannabinoids are a blast to think about, but the whole flower is still where it's
Well,
at.
right, but how relevant is it always unless we're trying to make like a drug out of the individual compounds? Because normally you're taking in hundreds of compounds, and we don't know what's happening in the synergies of different ratios of different compounds and the moisture level of your flower and how the terpenes and the other flavorants are all playing in the role. We have
Right.
no idea what's
We have
happening
no
there.
idea.
We
And
have no idea.
we still don't know why an apple is better than apple juice. We
Right.
don't really know. And we don't really know why a salad helps people have a lot less fracture if you eat one salad a week as you age. Who knows? I mean, who knows what it is? Everybody said, oh, it's got to be the vitamin K. I mean, okay, all right. But you have to eat the salad. You can't take the vitamin K supplement. So yeah, I mean, I would always encourage whole food, whole plant dieting, and whole plant smoking because there's definite synergies there that we'll never understand, and we don't need to. We just know that they exist.
I agree. I think that's also just the perfect place to end this episode on, with encouraging synergies and encouraging a diversity of different, medicines that you're putting in your body, different strains, different fruits, vegetables, whatever it is. Just encouraging eating whole plants. So that's awesome. So thank you so much for being a guest. I've really enjoyed this conversation, the entire
Really fun.
thing. Yeah, I've learned a lot, and yeah, I can't wait to share this with the world. I think people are going to really enjoy this episode. So thank you for taking the time to be on.
It's been great. I have really enjoyed myself. Thank
Cool.
you.
We'll have you on again in the future. I'll
Yeah,
start tallying
definitely.
all. Yeah, I'll tally all my medical questions and then save them up for when you're on next time.
Okay, I'll research and get them all ready to answer.
All right, I'm going to link Dr. Clifton's website and her book in the show notes, along with her social media platforms if you want to give her a follow. This episode wasn't originally supposed to be aimed at women's health and gut inflammation, but I love where the conversation took us. I hope you learned something new. I definitely did. Thank you so much to the Patreons for subscribing and asking amazing questions, as always. You can also suggest topics for future episodes if you'd like to. I'm currently looking for an expert in male and female fertility to come on and discuss cannabis and fertility. I'll keep you posted on that. You can join the Patreon for as little as $1 a month, and it helps support me and this podcast a ton. Today, I'm going to work with Jake, and we are going to go stalk pheasants in the North Country for some work that he's doing. I think we're going to try to post an episode next week on the transition phase of fall, including the chemistry of leaves changing, fall fungi, where to find them, how to harvest them, deer and moose, what's happening with their antlers and breeding season, etc. So stay tuned for that and some exciting cannabis research opportunities coming your way, which I will post a teaser on Patreon about. Thank you all for listening. Mad love, and we'll see you next week.